Hi there, I'm Miriam Evans, pelvic health physiotherapist in Powys. Here's a little bit of information for you if you had a cesarean section. Just to go through what happened for you, for most of you, some of you may have had a cut down the middle, depending on how hard it was to get the baby out. For a lot of people, they just have a little cut across your knicker line, which although it goes across the skin, and then once they're through the skin layer, they actually go down through the connective tissue that parts the two big muscles. So they're not actually going through the muscle as such, they're just going through the connective tissue and then into the uterus from there. So the damage to your stomach muscles is actually minimal, but because there's an operation going through them, they get switched off. And it's the switching off that's the problem, because if these muscles stay switched off, these muscles up here tend to start doing all the work, and you can develop that sort of posture, which causes a bearing down, long-term problems with prolapse and incontinence. So it's really important straight away to start getting this muscle here firing again to prevent that sort of posture or that posture that might develop. So I've done a video called core exercises, which you're welcome to have a look at and have a go at those exercises. From a cesarean section, it's really important to do your pelvic floor exercises, even though it's not gone through your pelvic floor, just because the pelvic floor works together with the core. So if your muscles and your abdominals don't switch on, the pelvic floor can be affected. Those are on a pelvic floor video, a separate video about pelvic floor exercises. And if you go to the core exercises video, have a go straight away in the first few days. You can do some pelvic tilting, and you can do some knee rolling side to side, and you can do the activation of the transverse abdominals. Then after about a week or so, depending on how you're feeling, if it feels a bit easier, you can lift your knee and do the knee lifts, and then after a week or two, you can start doing some chin lifts, depending on how you feel, how the wound feels. If it's painful, and leave it a little bit longer, so long as you're doing something and you're moving. It's really important to do the knee rolling side to side, because what it does is it's by doing a little bit of movement in this area, is the skin starts to move over the uterus, and where you've got the healing of the stitches in the uterus and the stitches in the connective tissue in the skin, it stops them being able to adhere and stick. If you don't move and get up moving, try day one just even getting up and having a little walk around, and regularly walking, even if it's a short distance to and from the toilet. Getting moving is going to stop that scar tissue, and it's going to help with recovery as you get circulation to the area. So one thing that's really important to remember is that although you can only see a little scar across your knicker line or potentially down your stomach, you've had major surgery. You've had the same surgery as you would have done if potentially you'd had a uterus taken out, or any other abdominal surgery. And you don't think, if it was a major surgery, you'd go home and you'd rest for a long time, but actually it's really hard when you've got a baby. So just be careful, be kind to yourself, take help when it's offered, rest regularly. Don't be surprised if you're tired for a few weeks afterwards, and just be really careful with the lifting. So the guidance we normally say is try not to lift anything heavier than a sort of mediumly full kettle. Don't fill it too full. If you're lifting a baby, then you have no option, but try not to lift anything heavier than that. When you do lift, the lifting advice really is, because your muscles are switched off, then there's a potential for your back doing all the work and your back muscles taking over and then causing back damage. So try and get into the posture when you are going to lift of tucking your tailbone under and then lifting. Think about bending your knees. So if you're bending over, try and avoid being in this position for a long time when you're changing nappies or you're lifting things. Pushing your pram, try not to stick the bottom out, tuck the bottom under. So as much as you can, try and think about just doing that simple pelvic tilt. You're engaging your lower tummy muscles in a very easy way. You're not going to damage your stitches. Your stitches are going to come closer, if anything. They're not going to stretch in that position. So activating your lower tummy. Even when you're just sitting watching telly or relaxing, you can just activate your lower tummy muscles. Just think about taking your pubic bone towards your belly button, and then you can relax. A bit like a pelvic tilt. I don't know if you can see that inside there. So I'm just relaxing and then tilting back. It's just an easy way to activate them. You can squeeze your pelvic floor at the same time, and then relaxing, squeezing, taking things easy. Driving is really important that you contact your driving insurance company. Some insurance companies won't insure you for 6 weeks because it's classed as a major operation. And the point of the driving is that you must be able to do an emergency stop. So with pain across your abdominal muscles, lifting your leg can be painful. So if you had to do an emergency stop and lift your leg, would the pain stop you from lifting your leg, and would you then cause an accident? So if you're contemplating driving and you feel like you're ready to, sit on the driveway, have a go at an emergency stop and make sure that you're not in any pain, then contact your insurance company and just check it's okay with them. So trying to get out and build up your exercise bit by bit. It's really important to get your core muscles strong before you do anything else, otherwise you're just going to cause injury. So have a look at the core exercises, have a go at strengthening through those in your pelvic floor, and then gradually get out walking a little bit further each time. And then once your stitches have healed after about 6 weeks, you can start doing swimming if you're interested in that. And the advice is to avoid running for at least 3 months because it's not very good on your ligaments. They've got to start tightening back up again. So just take it easy. Don't rush into things, accept help, and avoid heavy lifting where you can. So avoid lifting that Hoover, the pram, getting the pram in and out of the car. So just, if you do have to lift, engage your abdominals by tucking your tailbone under and then lift. Hope that's helpful. If you've got any more questions, then you can contact a physiotherapist near you, or have a look online at the POGP, that's the Chartered Society of Physiotherapy website, for advice post-cesarean section. You can download their leaflet.